Schools are supposed to be a safe space for kids, but in the Louis Riel School Division right now, that's not always the case.
We are seeing an increase in student aggression and student violence.
The division says it's seen a 263% increase in the number of incidents of unsafe behavior by students, which led to them needing to be clinically assessed. Clinical lead Alex Pinuda says it includes everything from verbal or written threats to harm others, disturbing or concerning posts on social media, to hurting other students and destroying school property.
We are seeing conflict escalate more often. Often what we're seeing is those risky, aggressive behaviors are going up.
Not all lead to assessments, but Pinuda says they are seeing increases across the board. He says kids are struggling to navigate conflict and the problem escalates. It's an issue he says they're seeing throughout the community.
And so the increase itself wasn't surprising. We had seen that coming. But it is a very big concern.
Louis Riel has around 20 staff trained to deal with these issues among a student body of more than 16,000. Pinuda says the wait for help is too long, and other psychologists agree.
It's frustrating from a service provider perspective because it's hard to keep up with the need, and by the time we see people, the problem is already so far advanced that it takes a lot longer to address the problem.
The province says there are 252 registered psychologists in Manitoba who are able to provide sessions covered under provincial health care, and funding for 5 others was announced last year. Dr. Raymond Abdul-Rahman says pre-COVID, the wait list to see one was at least 18 months, and private clinics are having to turn people away.
Our colleagues are inundated. We get calls at our clinic where people are saying, we've called 10 different clinics, nobody's accepting patients. My wait list is up at 6 months right now.
He says the system is breaking, and the ones who are suffering right now are these kids. Brittany Greenslade, CBC News, Winnipeg.